Hi there, welcome back. It is Medicare Monday, and it is the time in the show where we take your questions and hopefully get you answers. Joining me now is Kelli Jo Greiner, Medicare Product Manager for the state. Thanks again for joining us, Kelli Jo.
It's great to be here. Thank you.
Well, let's just dive in, not waste any time. We've got some questions for you. This is from a viewer named Amy. She says, my mom's UCare Medicare Advantage plan is going away, so she decided which new plan she wants to choose. But we've been unable to log in the Medicare.gov website. We've changed her password 3 or 4 times on different days with no success. Have you heard about anybody else having this kind of a problem?
I have not. I guess I'm not surprised that there are challenges with the website. What I would encourage her to do is to call 1-800-Medicare and ask them for help, or you can call Minnesota Aging Pathways, which used to be the senior linkage line, at 1-800-333-2433, and we can help you set up that password. We help people do this all day long. Yeah. And I haven't heard from the staff that there's been a problem with that part of the website.
Okay, good to know. And also, you know, carve out some time, have everything in order, because the calls are taking a while. Clearly, it's personalized information. And you did mention too on the Medicare.gov site that in order to get in and set up, I just want to remind people, it's like this 2-factor authentication thing where, you know, there's quite a bit that goes into it, but if you have somebody to help you or you know how to do it, that is going to be your probably quickest way to get it done. Thank you for that. So from Faith, we have a question. Do these Advantage changes include the Veterans Advantage plan on Medicare?
Oh, that's a great question. The veterans plans are not changing like the regular Medicare Advantage plans are changing. So you're good to go.
Okay, well that's easy. That's an easy one to answer, and probably some good news for anybody who has that. Also, we don't have this one on a graphic, but along those lines, I saw a couple of questions that came in. I don't know if we'll have time to put on there, but if somebody has a loved one in a nursing home, does she have to worry about any of this? And then hospice was another kind of subcategory of, like, if someone's on hospice, do they need to be worried about this as well?
Well, let me give you an example. If somebody is on UCare Medicare Advantage plan and they're in a skilled nursing facility or a nursing home, they are going to need to change plans in order to have the Medicare coverage on January 1st. So they should be concerned about that. If they have a plan that is going to be available in January, they don't need to worry about it. They don't need to make any changes. If they are on medical assistance, otherwise known as Medicaid, which most people in a nursing home end up having to go on because of the high cost, you don't have to worry about that either. Okay. You would just be able to stay with your plan, again, unless it's UCare, because UCare is making changes in a lot of their plans.
Yep, and sorry, go ahead.
And the second part was the hospice question. And all of the Medicare Advantage plans now offer a hospice benefit. So if you are on hospice and are satisfied with it and are not with UCare, you will be able to stay with that plan. Okay. As long as the plan you have is going to be available in 2026.
Okay, and just to step back for a second to give some context, anybody who's watching this who has UCare and you currently have Medicare Advantage, you're the folks that we're most concerned about, right, Kelli Jo? I mean, you're the ones who are facing the biggest changes, but others, if you have Medicare Advantage with other providers, still, I think your advice has just been just check because it's changing in some counties and not others, that kind of thing, right?
Yes. Yeah, there are plan changes with Aetna, United Healthcare, Humana, and Health Partners as well.
How about Medica?
So it's not affecting, and Medica too, and it's not affecting all counties, but it's affecting some throughout the state in various counties. UCare is affected in all 87 counties.
Yes, those are the folks that we really want to kind of, with a, stand on the top of the roof and just yell this every day, because these are the folks that we're most concerned about heading into the new year. We want people to have that coverage. The next question comes from Bill. He says, I'm going to be 62 next year, thinking of collecting Medicare since I'm not working. I only work part-time. What's the school of thought on starting Medicare at 62, or is it better to wait?
Unfortunately, you cannot get Medicare till you're age 65 unless you are on Social Security disability for 24 consecutive months. So that is not going to be an option for you at this point in time. What you can do at age 62 is collect Social Security, and I don't know if that's what you're thinking of doing, but Medicare eligibility for most people starts at age 65.
Okay. This might have a little bit of a crossover here. I wanted to ask you this question on behalf of a viewer who says, if I choose to switch to original Medicare, so not Medicare Advantage, but original Medicare, will the deductions stop? This could help me to decide to switch because I would receive my full Social Security payment. Then I could use those funds to pay my supplement premium. Does that make sense?
That is a great question. And one of the things a lot of people don't fully understand is if you enroll in a Medicare Advantage plan, you still have to pay the Medicare Part B premium. And for most people, that's taken out of your Social Security check. So that amount, unless you are on a special program for low-income people, you would still have to pay that Part B premium amount.
Okay. This one just fresh in here from Diane. This is another good one. Can my husband go off Medicare and go on my work insurance and then go back on Medicare when I retire?
Yes, definitely.
Okay.
There are people that do that all the time.
Fantastic.
All you need to do is call Social Security and let them know that you are making that change and you are going to have your spouse's employer group health insurance coverage, so you don't need Medicare. And then you would not have to pay the Medicare Part B premium either, which would save you some money.
Okay. How is it going right now? Every week when we talk to you, I know you are right there in the thick of it as your folks are taking calls and answering these questions through the Pathways, Minnesota Aging Pathways line, formerly Senior Linkage line. How are things going volume-wise? When should people call when they don't have to maybe wait as long?
Yeah, things are still very busy, as you can imagine. And we encourage people, it used to be early morning. Now we're saying call about 1 o'clock. So 1 o'clock to 2 o'clock.
Okay.
And the other thing is we are looking at possibly hiring some contractors that know Medicare and know call center work and getting some help from them so we don't have this call backlog that we have, and we don't have these extra long wait times that we know is so frustrating for people. We know that people have been so patient waiting, but they would prefer to not have these long waits, and we would prefer to not have them either.
Yeah, and just really briefly, I wanted to help people understand the different players involved here. So you see the Minnesota Aging Pathways, which used to be the Senior Linkage line. That's what Kelli Jo is representing here, and those folks can help you explore options, right? You want to kind of delineate what they're doing compared to, say, a broker?
Sure. Through 1-800-333-2433, Minnesota Aging Pathways, we will help people look at all of their options. If they make a choice, we will help them enroll in a plan. What we will not do is make that decision for them. And we will look at all plan options, just not a few of them. Brokers and agents are wonderful folks to seek out for help. If you have got a broker or agent, they can help you with selecting a plan and enrolling in a plan. The one thing to be aware of is they may be only selling plans from certain companies, so those may be the plans they're going to want you to look at enrolling in. And not that that may not be the best plan for you, it may very well be.
Okay, really quickly, last one. If I turn 65 in May, when do I have to apply for Medicare?
You turn 65
In May.
in May. You should do it 3 months before your 65th birthday.
There we go. Kelli Jo, thank you for your time. We'll see you hopefully back here, same place next Monday for more Q&A. Really appreciate your time. Thank you.
Okay.
All right.
Thank you so much.
Take
and
care.
Everybody have a great day.
Yeah,
Bye.
we'll see you soon. Kelli Jo Greiner.
Bye.